Thank you guys for attending this webinar with me today. My name is Dan Foley. I'm a physical therapist working up at our Wilmette location. I just want to say right now we're actually in our new space that we'll be transitioning into, or really expanding to. Right now there's no one in the room, doors are closed, that's why I don't have my mask on. Any other time you came to our clinic, all of us would be fully masked, but no one's in the room right now, so I felt comfortable taking it off. Again, one thing I wanted to mention, React is still fully open, taking patients both in clinic and telehealth services. So if any of you have been thinking about coming in, we just want to assure you we're taking all the necessary precautions to make you feel safe here. We're wearing masks, wiping everything down, putting blocks in so that there's not overlap with patients, and it's not crowded in here, especially in our Wilmette location, get a little crowded, but we just want to make sure you're comfortable in here. So if you are interested in making an appointment, you can do so online now. Book your appointment with the clinician you want at the time you want, and then we'll get back to you. So with that being said, we're going to get started. I'm going to share my screen here. And let me start the presentation. So today I'm going to talk to you guys about how to effectively strengthen your glutes. Again, if any of you have been a patient here at React, pretty much any pain, we really emphasize glute strength and think of it as a main aspect in pretty much any kind of rehab. So to start, I'll try to briefly go over what the glute does and why it doesn't work, but I want the bulk of the time to be spent on exercises and demo. But your glute, one, is a powerful hip extensor that propels us forward when we walk, run, or we jump. You can see in the picture here, I don't know if you can see my mouse, but this big muscle here that attaches your sacrum, which is just the bottom portion of your spine, big wide muscle that attaches all the way kind of the side of your hip at that, where you get that hip pointer. So, biggest muscle we have, very strong, very important for many reasons. One, it controls and drive motion such as standing up and sitting down, climbing stairs, or bending forward and returning to standing. Those three motions in general, things we treat a lot because usually those are contributing factors to pain. So if we're keeping our glutes strong and training them properly, you're going to find that those motions are easier, especially if you're dealing with back or knee pain. Your glutes also keep our trunks erect. So a lot of people don't think about it that way. A lot of people, focus on their core to stay upright or maybe your shoulder blades. But you'll notice with your glutes, if you squeeze your glutes and bring your pelvis underneath you, your upper body automatically straightens out. So obviously, we don't want to stand around with our glutes squeezed all the time. The idea is if you train them more in specific ways, in specific positions, they'll actually start to turn on more on their own, more naturally. You'll stand with better posture and you'll move with better mechanics. And lastly, your glutes stabilize your leg. So when you're walking and your heel hits the ground, if you're going to do a lunge, if you're going to sit down, your glute max, we're also going to talk a little bit about your glute med, which is up here, and then your glute min. They kind of hold the top of your femur, the top of your thigh bone into the joint. And they control that motion. So if your glute's not working, that joint's moving a little looser, and you have to fight for stability elsewhere, whether it's your back or your knee. So keeping your glute strong and engaged is important. What causes your glute to not activate properly? All the time we have patients come in who say, yeah, my glute won't fire, I can't get it to work, I lift. Why is that? There could be many reasons. One is the presence of or history of pain, usually recent pain. When your leg hurts, let's say you sprain your ankle. We'll look at the picture down here. Let's say you sprain your right ankle. When you sprain your ankle and you go to put weight on your right foot, it hurts to put weight on it. So you're quickly going to shift weight back to your left foot. What happens is that interrupts the gait pattern and it doesn't allow this right leg to come behind you, right? Because your leg hurts. So you're not going to go through this full phase. You're going to switch back to your left foot and take smaller steps. What happens is the glute, if you're not making your hip go behind you, it's not going to turn on. It doesn't feel like it needs to because you're not letting it stabilize the leg. You're not letting it do its job because it hurts, so it shuts down. So as you start to feel better, it doesn't hurt as much to walk, but that glute still isn't really woken up again yet. Other reasons are poor hip mobility or soft tissue restrictions. So whether it's the hip joint itself that's not gliding in the joint properly, or whether you have restrictions in the glute itself. If your hip flexors are really tight, we preach that a lot. Most of us sit throughout the day on most days where your hips are in flexion. So if your glute's a hip extensor and your hip flexors are tight, you're not going to get that full amount of extension that we need. So again, if you're not getting that extension that's needed for the glute to work, it's not really going to turn on. It's going to become lazy and other muscles are going to turn on. Abnormal movement patterns, again, that goes hand in hand with what we talked about. If you're walking differently, if you hurt your back, threw your back out, or hurt your knee running, you're going to move differently to avoid those painful positions, and eventually one side kind of shuts down. And then lack of proper training. Sometimes you're doing some exercises that you think are for your glutes, but then the next day your hamstrings are sore, or your back hurts. So you might be doing the correct exercise, but you're either pushing it too fast, or you're not taking or you're overdoing it weight-wise or resistance-wise. So we're going to talk about that today. Real quick, again, these are just to name a few, but some common conditions we see with patients with poor glute strength. Low back pain is huge. A lot of times people who have chronic low back pain or even acute low back pain aren't using their glutes properly. You go throw out your back, whether it's one side or bilateral, and eventually those muscles around your low back become so tense that they start doing what the glutes should do in a sense of stabilization purposes. So your glutes shut down, your back muscles become really tight, over-facilitated, and they almost develop these trigger points in themselves. If we reduce the tension in your low back and strengthen your glutes, we often see that pain lessens. Plantar fasciitis is another huge one. A lot of people don't recognize the importance of glute strength with plantar fasciitis. If your hip's not moving properly, 1, 2, that usually means your glute's not firing. You're going to be overusing your calf muscles, your feet muscles, maybe your hamstrings. And a lot of times when we have patients come into clinic with plantar fasciitis, we get them feeling pretty good just by doing some glute strength. It might not take it all away, but it will help. Other ones, real quick to name, anterior hip impingement. So you get that pinching pain when you sit or when you go into a deep squat. Kneecap pain, common in kids who are growing. After you run, you feel good, but then when you get home, your knees are achy. That tends to be lack of glute strength. IT band pain, your glutes attach onto your IT band alongside your hip. So if they're not working, the muscles in the front are pulling that IT band forward, and they're going to cause that burning pain on the side. And then shoulder pain too. If your glute's not firing properly and you're not stable, and you're someone who's like an overhead athlete or you're doing a lot of overhead work, you're using that shoulder too much to actually stabilize you and not enough in your glutes. But again, these are just to name a few. Effective glute training is important in any kind of rehab, post-op, really anything. So this really can benefit anyone. So why are we here, right? How do I get my glutes to fire better? So this is kind of the little routine, little recipe I have for patients who are struggling with glute strength. So 1, active releases involved in surrounding tissue. We're going to talk about that on the next slide. 2, activation exercises, basically exercises that get you a feel for how to turn on your glute. Then some dynamic strengthening. We're going to talk about the hinge, the squat, and the lunge. Burnouts, just muscles to kind of burn out that muscle. That's when you're going to get that soreness the next day. Light static stretching. I'm going to show you 2 stretches that I sometimes use, depending if it's indicated, and then you'll finish with walking or running. So why the releases? If you've been to React, which I'm sure most of you have been, we're big in the active releases. We use the Reeve method. So if you've been in here and we're digging our elbow in somewhere and making you move that leg, that's an active release. And what you can do on your own with a lacrosse ball is do the releases on your own. So it's very useful for those who are in pain or recently recovered from injury, because a lot of times there's a muscular imbalance. It breaks up soft tissue adhesions within the muscle itself, or if, like we talked about the low back example, if you're having low back pain and those muscles are doing too much, basically the idea, you use the lacrosse ball to release the muscle, turn it off in a sense so that the glutes can turn on. So we're going to talk about 4 ways to do that in these next few slides. Again, so with all of these examples, we're using a orange lacrosse ball. You don't have to use a lacrosse ball. We kind of get the best results with that. If you have a massage ball, a baseball tends to be a little too firm. Tennis ball tends to be a little too soft. But, if you have nothing, it's better to use that than nothing. But just wanted to let you know we're using a lacrosse ball. So here I am in the first one. And this is the glute release. So you can see I'm on my hands and my feet. I got the ball right in the meat of the glute. Okay, you're going to kind of fish around for a sore spot. And once you find it, you're going to move that leg in and out for about 30 to 45 seconds. Okay, I try to make these videos pretty quick. There's really no trick to it. You put it in where that glute attaches, just right into your butt. Find a sore spot. When you find it, move the leg in and out. You're going to notice that, 1, it's sore, but then as you do it, it releases. It becomes more comfortable. And then you'll want to fish around for a second spot or get the other side. I think doing both sides is beneficial, even if the other side doesn't hurt. The QL release. So these are our patients who chronic low back pain or someone who recently threw out their back. If you feel like your back's always tense, whether you're weightlifting or whether you're just walking to walking up the stairs in the morning. This would be more for you. If you're going to do a glute routine, you want to reduce the tension in those muscles. So you'll see right here, sorry, he's going to put the ball right. I kind of call it like the pocket of your low back. So you're going to find your spine, and then you're going to go just to the side of it. So if you have right low back pain, you're going to put it just to the right side of your spine, place it, and then slowly ease back down onto it. You're going to kind of tighten at your abs, get yourself stable, and then you're going to turn that right leg in and out. Okay, he's getting to it. And then for about 30 to 45 seconds. I would find about 2 spots. Again, with those who have back pain, that will be tough for you. It can be pretty tender, but you'll find you'll get better glute firing if you reduce the tension in those muscles. Hamstring release, this is big in runners, kids. You have a great workout, you feel good the next day, but your hamstrings are super tight, they're super sore. You're hoping to get a little glute workout, but all you can feel is your hamstrings, sometimes it's your calf too. This is what I would have you do before and maybe even after a run. You're going to take the lacrosse ball here, they'll get to it, and this is going to depend on what kind of hamstring mobility you have. But you're going to take the lacrosse ball, she's getting to it here, and you're going to put it underneath your thigh. You're basically same idea. You're going to fish around for a sore spot, put some pressure down into it. You almost push down into the ball, and then you're going to kick your leg in and out. Okay. Again, in the demo, that's good hamstring mobility there. If you feel like you can't get your knee all the way out, that's fine. The idea is you're just contracting and lengthening the muscle as the ball is underneath there. And then the last one, the hip flexor release that David is going to show us here. Basically, you're going to find that inner hip bone, and you're going to put it on the inside of your hip. Missed it here, right? Sorry, there. So you're going to put it on the inside of his hip. Your hip flexors are really deep, so you really have to put your full body weight on it. You're going to shift your body weight over it, find the sore spot, and then turn in and out. Okay, we talked about it before. If your hip flexors are tight, then your hip extensors, your glutes, are not going to fire the way they should. So if you're someone who has a lot of tightness in their quads, or if you kind of do like a lean back and you feel some tension in the front of your thighs, this one's probably for you. Okay, or if you're someone who sits a lot during the day. All right, so now we're going to talk about activation exercises. So the purpose of activation exercises is not to get a huge workout. It's just to get an idea of how the muscle should fire. So in this example here, these are called bird dogs. These are kind of a hallmark back pain exercise. Hands and knees, and then you're going to extend one arm and one leg, opposite arm, opposite leg. You want to create as much stability as you can. Okay, so you're going to tighten at your core, your abs, and you're going to extend your left leg back. When you get back there, how my leg is fully extended, you're going to feel that glute turn on. That's what you're going for. You're getting an idea of how that glute should fire. You're going to hold it, and then you're slowly going to return back to position. I do about 10 to 12 of these. And the idea, you almost want to think that there's a glass of water in your low back. So when you go out, you want to keep your back straight. So if there was a glass of water there, it wouldn't tip over. Again, keeping a straight low back. Sorry, if I'm talking a little fast, I'll try to slow down. Next one, I call them clam planks, just like a side plank. You're here, and you're going to come up. The big thing here with side planks, a lot of times when you go up, people kind of keep their pelvis behind them and they stay in that hunched position. When you come up, you want to squeeze your glutes tight. So it's kind of a short video, but you want to think that there's a straight line from like my left shoulder to my, it's my right shoulder to my right knee, so that you're in a straight line. You don't want to stay hunched back. So this will work your abs, but it will work your glutes too if you focus on keeping your pelvis in line with your body. Okay, it should be a straight line. You should feel your glutes and your abs firing with a side plank. And then I call them clam planks too at this top leg to make it a little more difficult. You're going to raise that right leg up, and that's actually going to give you a burnout in that top leg too. So this is really kind of a full body exercise. So you're up, and then you're slowly going to lower back down, which I don't have. Okay, but you're going to hold, about 5 to 10 seconds as long as you feel like you can, and do about 8 to 10 reps of them. All right, dynamic strengthening. This is where we get into the real bulk of it. Again, some of these exercises are a little more advanced. I gave an example of a double leg and a single leg one for most of these. But just know that if you're working with, a lot of pain and any of these hurt, this is something you work up to. So if these are too much, then that's something where, you'll have to ease back and you'll do more reps of the easier exercises that I'll show you later. The first one are called good mornings. Let's see if I can move fast forward. Okay. Let me exit out here. So good mornings here. You'll see David. He's going to get himself set. Basically, he's just talking about your foot position. So you want to be even, ready position stance. He's going to tuck his shoulder blades back so that he creates stability. The whole idea here is you're keeping your back straight, okay, and you're not rounding at your low back. You're going to stick your butt back so that your butt comes behind you. Yep, just like that. And you'll see here how his back is straight. Okay, so you're focusing on keeping your abs and your lats tucked back so that you're stable through here and you're getting all your bend at your hips. Okay, so when you get into the position here, you're going to feel a pull in the back of your thigh. That's your hamstring. When you come down, you're going to hold that until you feel a good stretch. And then you'll see in a second, he's going to come up here and see when he comes to the top how he tucks his butt underneath himself. That's one of the more important parts of this exercise too. A lot of times, if you're someone who deadlifts or if you've done these good mornings before in clinic, we cue you, don't stay in that hunch position. You got to come all the way up and bring your pelvis underneath you. You see when he brings his pelvis underneath him, he's squeezing his glutes at end range and his whole body immediately becomes straight. Okay, and then you're going to reverse the motion. You're going to come down and come all the way up and tuck your butt in. Okay, just back and forth. Once you get a handle of these, they're pretty easy. You can always add a band around your shoulders or strap a band kind of around your waist so that it's tied behind you so that when you come up, you're pushing into resistance. But this is a huge exercise if you're someone who has thrown their back out on multiple occasions. Learning how to hinge forward, keeping your back straight. One is going to be good body mechanics training so that you can avoid that in the future. But it's also going to work on glute strength because you're bringing your glute to end range here and then all the way up at the top. Okay, good postural exercise, good motor training exercise. The next one's a lot more advanced. This one's a single leg RDL, so a single leg hip hinge. Let me open up full screen so you can see. So single leg, same idea. You want to keep a straight line from pretty much your head to your foot. Balance component is huge here, but when you can get good at the balance, you're going to come all the way down. I'm going to pause it here because this is usually, if you're learning this the first time, this is probably as far down as I would have you go. But you can see here, perfectly straight line. He's keeping his low back straight. He's extending his left leg behind him. So one, his left glutes turned down to keep him stable here. Shoulder blades are tucked back, but then he's hinging over this right hip. Okay, your glute is controlling that motion. Or it should be. If you go through the routine, it should turn on here. And you're going to go down as far as you can. As you get better at it, you want to get as straight, almost parallel to the ground. You'll hold it, and then you'll slowly come back up. Okay, so again, balance component is huge here. So if you need to have a PVC pipe handy, do it next to a countertop or a wall so that you can kind of catch yourself to balance. But once you get this down and it feels easy, you can do 8 to 10 reps without issues. You can add weights into your hands. So instead of having your hands up by your head, let them extend out out in front of you. So you can add weight to it. Start with 5 pounds in each hand, 10 pounds in each hand. That's a way where you can progress once you get good at it. And you'll feel, especially when you add weight, you're going to feel that glute working. You're going to feel your abs working as well. All right. Next one, we're going to talk about the squat. Okay, the squat is huge. Hugely important exercise. All of us squat every day, getting up, down and off the couch. Movement training properly can really translate well into your day-to-day life. Okay, so this is me squatting here. When you squat, let me get you where it starts. Okay, feet are even. Just kind of feel whatever's comfortable for you. When you start the motion, a lot of times we see people kind of collapse straight down and their knees fly over their toes and they don't get their butt back. To make squatting a glute exercise, which it almost always should be, you got to get your butt back. So you stick your butt back and then you sit straight down. Okay, butt's back, straight down. Your knees can come over your toes. They should come over your toes. It's going to depend on how much ankle mobility you have. Then you want to explode back up. And see, even in the squats, as I come up, I'm bringing my pelvis underneath me and I'm squeezing it end range. And then I'm just reversing the motion down. Okay, again, this is going to depend on if you're working with pain or not. If you're someone who has knee pain, I would go a lot slower and focus on the downward motion. You just go down as low as you feel comfortable, and that what feels good for you. Okay, so that's double leg squat. With a single leg squat or a Bulgarian split squat, you're going to get in this position here. So my right foot is directly underneath my right hip. My left leg is behind me. You want to get it to where your left knee is a little bit behind your left hip, and so on. And where the foot is elevated behind you. 90% of the weight's going to be down on this right hip. Just think of the left leg as more of like a kickstand, and then making sure your upper body's straight. You're going to go down as low as you feel comfortable. The lower you go, the more of a glute activation you're going to get. Obviously, this depends on what kind of mobility you have, what kind of control you have. But the lower you go, the better to get that glute to turn on. And this is one too. It's not just going to be glutes. You're going to get a burn in your quads as well, maybe your hamstrings. But if you're keeping your foot flat, you're coming all the way down, and then when you come up, see again, I'm thrusting my pelvis forward so that's directly underneath me. You're going to get a good glute exercise here. And as this becomes easier and as your balance improves, you can hold a kettlebell, you can hold dumbbells to either side of you. It's just important to stay controlled, okay? When you come down, you don't want to collapse down really fast and come up fast. You got to control it. It's got to feel smooth. The smoother it feels, the more stable your knee and your foot are, the better you're going to feel the next day. All right, and then the lunge. So again, we did the hinge, the squat, and the lunge. Very functional exercises, really important to teach properly. We didn't have one on our YouTube channel, so I made one really fast here. So we'll just talk about the position here. I try to get a side view in the next one. It's a view from facing the other way. But this is the position you kind of want to be in the lunge. You're going to get it in deep knee bend, as far down as you feel. Again, we got my hands out to the side. My arms are making a W so that I'm upright and stable, going down as far as you can, and then exploding backwards into original stance. Okay, down and back up. Start slow. Start with going down halfway and push yourself back. Once you feel more comfortable doing it, or as it feels better, you'll progress. And again, you can always add dumbbells to this motion. The last lunge we're going to talk about is the curtsy lunge. Again, one that's more advanced. Let me get it in full screen here. So starting in neutral position. Okay, we're going to be working the left leg here. My left leg's coming down and back behind me. I'm reaching it back to the opposite side, so towards my left side. That's going to drop my right hip, and it's going to load the glute. You're going to feel right away, it's going to feel tight in the glute when you do this one, and then you're going to come back up to even position. Reach back, even position, okay? And again, with this one, it's a little more difficult, but keeping your shoulders straight and upright and not bending forward are going to be huge. If you're losing that stability in your trunk, in your spine, your glutes aren't going to activate because you're not keeping your pelvis level. All right, you got to keep that trunk upright, as stable as you can. And it's going to depend on mobility. Again, this one's more advanced. It's something I would work up to unless you're already in a program where you're working your glutes. I don't have the chat open right now. I'm sure there are some questions through those. I'm going to go through these last few, and then we can circle back to these. So burnouts, some of us call them corrective exercises. I picked 2 of them. There's so many out there. If there's one, kind of a basic glute exercise that you do that I didn't cover, we can talk about that at the end. The idea here is you're just burning your glute out. You're isolating your hip so that your glute's firing, and you're going to do as many reps as you can in one set. Take a break, one more set, take a break. It's just a good way to finish out an exercise if you're really trying to build muscle within your glutes. One we use all the time, hallmark exercise for back pain and hip strengthening, is the bridge. Okay, so you're starting hook line position, on your back, knees are bent, arms are at your side to help you balance. Once ready, driving your pelvis up towards the air and down. A good little trick to make sure your glutes are firing is that when you start here, you want to push your feet into the ground as if you were going to slide them on the ground, but you keep them stable. Okay, kind of push through your heel or your arch of your foot and come up. You're going to find if you do that, you're going to feel it more in your glutes and less in your quads in the front of your thighs. Okay, so I did it a little slow here. If these are easy for you, you can do them fast. You can add a barbell to it if you raise your shoulders up. If you've ever heard of barbell hip thrusts, But if you're someone who doesn't do glute exercise a lot, this is where you would start. You would come up, pause for a 3-second count, and then slowly lower back to the ground, okay? 2 sets to fatigue. As many as you can do in 1 set, take a break, and then another one. If those are too easy, you can also do single leg bridges, which I didn't add on here, but you would straighten your left leg and do the same thing, but you'd have to hold your left leg in the air. All right, and then the last one, the clams. I'm sure everyone's seen these before. You're here, you're keeping your pelvis level, and you're just raising up at the hip, okay? So only thing that's moving is her hip here. It's up, pause, and then she's gonna slowly lower back down, okay? You don't wanna roll. Her left hand is a cue there so that her pelvis doesn't roll. You're just moving at your hip. This one, you're gonna feel a little bit more on the side of your hip. This one's more of a glute medius exercise. Huge for leg stability, especially if you're dealing with knee pain. Runners, if you get knee pain after the end of a run, this is an exercise for you to do at the end of your routine. You can add a band, a TheraBand. Oftentimes we'll use, a yellow or red band. If it's easy, go faster. Your range is going to improve as you go. So that's a good finisher there. Last part of the routine, second to last part of the routine we'll talk about is stretching. I'm not huge on stretching in the sense of, it's a necessary part of routine. It is necessary if you feel that after an exercise, your glutes are really tired, feel constricted, get that sensation like they're going to cramp up, or if you're someone who's dealing with sciatica, piriformis syndrome, maybe, some sort of glute tendonitis itself, then I would definitely have you do these. These are 2 options. Again, there's a lot of them out there. Similar to your pigeon pose in yoga, you're going to bring your right knee across your body, let it sit on the ground. Once you feel set, you're going to reach your left kind of back to where your right heel would be. Hold the stretch, 45 seconds to a minute, and then you'll ease out of it. You'll do that 2 times. If that one doesn't feel comfortable for you, there's this one, the 90-90 shin box stretch. You're going to get in a position here where your left, so I'm stretching my left glute here, where your right knee's in front, or your left knee is right in front of your hip, bent at 90 degrees, and your right is behind you. Same idea, you're hinging forward down until you feel a stretch in your glute. You'll hold that for about 2 times for about 1 minute. There also, if you like doing mobility before an exercise routine, you can do this as well, but just know I wouldn't do as long of holds. I would do quicker in and outs, kind of like I did there. I held for 5 seconds and then I eased out of it. But really you can pick either one that suits best for you. And lastly, I think is a very underrated portion of a leg routine, or really routine in general, is walking afterwards. If we find, your therapist or you yourself, you feel like your walking is off, and if glute is a contributing factor to that, your glute weakness, walk after routine. The idea here is you're getting your glute to fire better, you're burning it out, you're waking it up, however you want to say it. Walk afterwards. Walking is very functional. Obviously, I hope we're all walking a little bit per day. 20 to 30 minutes, it's going to reinforce that strengthening you just did. It's going to reinforce good mechanics when you walk. So even if it's 5 to 10 minutes, I put here, it doesn't need to be, a 20 to 30 minute walk, although I think that is best, whether it's on the treadmill, around the track, or somewhere outside. But it's going to reinforce the progress that you just made, so it carry overs into walking. All right, so quick review. I know I just went through a lot, and we'll get to questions at the end. I apologize if I was talking fast. 6 steps. Your active releases, which the videos were shown above, 1 to 2 times, 45 seconds in the evolve region. Second, your 2 activation exercises. You're going to do 5-second holds, 8 to 12 reps. Those are the bird dogs and the side planks, or the clam planks. And the idea there is not to burn them out. You don't want to burn them out right before your routine. It's almost to wake them up, to get them firing, to get a feel like, what those muscles do, so that you can be aware of that in the strengthening portion. And like I said, the dynamic strengthening, your hinge, squat, and your lunge. I put 3 sets of 6 to 12 reps. That can vary. Some of you may only be able to do 3 reps of the single leg squats, or some of you can do 15. I'd try to generalize it. That's where I would start. If you can do 12 reps of something, no problem. I'd advance and add weight. But just pick ones that work best for you. Again, that single leg hinge or the single leg lunge, those are more difficult. You might have to work your way up to that. But doing at least one of each of those consistently 3 sets to where it's difficult for you, it might not seem like a lot, but you're gonna feel that the next day. And then you're gonna do your burnouts, 2 to 3 sets to fatigue. Those are your bridges and your clams. There's a lot of other burnout exercises you can do, but I tried to pick the 2 that were most simple, but also ones that we use most often in clinic. Just because they're simple doesn't mean it's not working. Exercises don't have to be advanced to get the results we need. 5, light stretching if you're feeling really tight, if you have sciatica, low back pain. I don't think it's necessary, but if you're someone whose mobility is a goal, then I would do stretching at the end for longer duration. And then ideally you'll walk 20 to 30 minutes afterwards to reinforce the progress you just made. Some quick points to consider. After your first or second routine, you may be pretty sore in your glutes the following day. That's normal. However, being sore the day after is not necessary. And don't think that if you're not sore in your glutes, you did something wrong. That's a pretty big myth. To know that you did an exercise or a routine well, the big indicator is that the next day you feel better, whether it's you have more energy, whether you just feel generally stronger, or if you're someone who has pain, that pain went from a 4 to a 3. Or when you get out of bed in the morning, it's easier to roll over. It's easier to get dressed or get off the couch, right? That's an indicator that you had a good workout. Not necessarily, you don't need to be super sore in your glutes. It may happen after the first or second routine, but after a while, your muscles will adapt and you won't get that soreness. Now, if you wake up the next day and your hamstrings are really sore, then that's something where you have to step back and say, all right, I got to be a little more cautious of how my form is. Focus on your glute throughout the routine. I'll have patients put their hands on their glute during certain exercises so they can make sure it's turning on. It's called therapy localization, basically a fancy term for you put your hand on the muscle you want to turn on. It has a higher chance of actually working. So if you're doing some exercises, you're not sure if it's turning on, put your hand on your glute and make sure you're feeling it squeeze and tense up and then relaxing. This won't only help your activation through the exercises, but it's going to help your engagement. Staying focused on task during a workout is hugely important. If your mind is elsewhere, thinking about work, thinking about any personal things, and you're not focusing on your form and what you're doing, you're not going to see the results that you want to get. Okay, you got to be focused, stay engaged during your workout. And then take rest days. This routine, I can't stress this enough. This is not something you do every day, 5 to 7 days a week, 2 to 3 times a day. If you're someone who's an active weightlifter and you're here to learn just some quick ways to do it on your off days. In between days. If you're someone who's rehabbing right now from home, 3 days a week. All right. If this isn't something you need to do every day, mix it in every other day with other exercise routines that you have. Okay. So let me stop share here. All right. So a lot of questions here. Okay, so I got a question. Double leg bridges often really fire up my hamstrings. Is there something I can do to make sure I get that benefit more in my gluteus and less in my hamstrings? So Tim, what I would say, I think I mentioned it while I was doing it. When you're setting up for the double leg bridge, you want to drive your feet into the ground. That kind of goes for any exercise. If you're doing squats, kind of focusing on driving your foot, almost like thinking there's a bug underneath your heel. Squashing the bug, that should allow more glute turn on. If that doesn't help, I would recommend doing some hamstring releases like I did in the video where you're sitting on the edge of the table, you put a lacrosse ball under your hamstring, and then you straighten your leg in and out. So I would try that. But again, if that's one where you're just not getting turn on, there's tons of other options. You can always modify it. All right, I'm going down the line here. Sorry, I know I did move really fast, so I apologize. This is being recorded. All the information will be shared on our website, and I did list my email at the end, so I can go over some stuff with you guys. Okay, I see Ashley's answer that question. Okay, so right now I don't see any other ones, but if you have a question, go ahead, type it in there now. While you do that, if there are any, again, reminder, we are open. If this is something where you feel like glutes are an issue for you, and you think it's something that will help you get back to what you need to be, give us a call. We can do this in a telehealth service. So if you don't want to come in, you can sign up in a telehealth session with me. I can watch you do all those 10 exercises we just went over to make sure you're doing them properly, to give you cues on how to make them less painful. again, telehealth service can be really great. I think it's really underrated because it can be quick. It doesn't have to be an hour-long session. It can be one session. It's just a good way for me to review how you're moving, and maybe we need to modify some of the exercises that I sent. And you can, like I said earlier, book that online with any clinic, any therapist you'd like, with a time that's perfect for you. All right, doesn't look like I have any more questions. So this webinar is going to be shared on our website, and it will have my email listed on there. So if you have any questions about these, let me know. I'm going to try to get these converted into one big YouTube video, and I can send that out to people as well who are interested. But with that, thank you all for coming. I appreciate it, and I hope you have a good rest of your day.